Hi, my name is Erin West, and I'm a doctor of traditional Chinese medicine and licensed acupuncturist in beautiful Gilbert, Arizona. My clinic is Emend Acupuncture and Chinese Medicine. My area of specialty is infertility and pregnancy related conditions. I typically don't do videos, but recently I just have felt compelled to discuss hormone imbalance. And it's really quite an epidemic right now in our culture. I really think that there's a lot of factors. One that I usually press quite persistently with my patients are the repercussions of our SAD diet, so our standard American diet, which has really just been wreaking havoc and more than just affecting digestive problems and digestive health, but actually the brain. And this is an area that I'm very eager to learn even more about, other than just what we learned in grad school, as well as with continuing education. Neurologists are really picking up more and more that uh, the diagnostic tools are amazing, but their treatment necessarily isn't the best in how do we treat brain health and brain issues. So, um, when we think about hormones, we do know that there's a factor in how our whole body works. Hormones are chemical mediators and messengers, and so they really tell the body all of the different processes that we need to do, what to do. So, I wanted to discuss the thoughts about what are the biggest factors that are affecting our hormones, and not necessarily just pertaining to wanting to get pregnant, but some people will come to me. I have a lot of bodybuilder and weightlifting patient base, and they're wanting to look at their hormones from a different standpoint other than just fertility concerns. So I wanted to just say what the three biggest epidemics of hormone imbalance is. And one we know is an increase in insulin. And typically, insulin is going to be something that responds really dramatically to starches and carbohydrates and sugars. We can classify all of those as very much the same thing. And so that increase in insulin is a major problem. The other is an increase in cortisol and even adrenaline. And we know that that's very sensitive and responds very strongly with stress. And the third is a decrease in thyroid hormone. I'm sure you probably know somebody who has low thyroid or who has to take thyroid supplementation, or even as far as Hashimoto's, which Hashimoto's is an autoimmune disorder affecting the thyroid. It attacks the thyroid gland. That is something that we're seeing more and more of too, our autoimmune disorders. So when we think about our hormone imbalance, all three of those affect sex hormones. So sex hormones, we've probably all had some thought about, depending on what age you are. Some it's when in menopause, you're clearly thinking about your sex hormones then. Infertility, or in your reproductive years and you're wanting to get pregnant. As well as sex hormones in just how you feel. Do you feel energetic? Do you feel vibrant? Do you have a healthy sex life? Which is another subject, and I really like to reiterate just how important that health is too, and that if there's a problem there, it can really indicate that there's a problem elsewhere too, and definitely not to ignore it. So I love working with infertility. I also love working with people who are just wanting to look at their body's health and look at the different signs that, hey, the body's not functioning really well. And typically we use a combination of acupuncture, herbal medicine, whole food supplementation too, especially if our diet isn't the best, and especially if it's the standard American diet, then we do need to supplement with things. We know too that the soil is depleted, especially with just how farming is and certain chemicals that are used. So we're not getting all those micronutrients that we would normally get in certain foods. I will say just a little tidbit about sulforaphane. Sulforaphane is something that's very widely known now and even being more researched for having anti-cancer effects. We like to get it from food. Where do we get that? That's typically cruciferous plants. So let's just take broccoli and Brussels sprouts. sulforaphane should be in abundant supply in those foods, so we want to eat more of them, which would make sense to me. However, we are testing the sulforaphane levels in regular over-the-counter broccoli and organic broccoli, and then broccoli grown maybe in fields that have really been pretty much organic the whole time, even rotated and the soil nurtured properly. So the over-the-counter broccoli that's just plain has 0 sulforaphane when tested. Organic broccoli, when we test that, has, about this much sulforaphane. Still better than 0, but not as much as what we'd normally find in nature. And then the other crops that are grown in very different areas. I'm a huge fan of Standard Process, and I actually went to their farms and saw where they get their crops that they're using to make whole food supplements with, so that you know where you're getting your supplementation from. It's actually from food. So I was very excited and also quite shocked to see that they had the highest levels of sulforaphane found in their broccoli from their fields. So it's pretty inspiring to know that, but pretty hard when if you think you're eating right and you're, getting down your broccoli and your Brussels sprouts, and yet you realize that there's one major factor in there that we're just not getting. Now, keep eating your broccoli and Brussels sprouts. I obviously think organic would be a better way to go, but either way, get it in. It's still going to provide fiber and other things, and it's good for you. But when we just look at one of those little tidbits of what would actually be in that, it's sad to know that it's not even in there anymore, or it's at really low levels. We want to exploit that for our health. So anyways, if you ever need anything, you can always visit my website, emendhealth.com, spelled EMEND, health.com. And I am definitely okay and happy to answer any questions that you have regarding this subject. I'll try and do more videos. I'm definitely not a video person, so I will try and get more videos up, and it's just a quicker way for me to get that information out as opposed to just one-on-one with patients. I think we need to all help each other and support each other in finding out what the best ways to live life and live a long life and live a pleasurable life, not just a long life. We want to live a good life where we're feeling good, our bodies are vibrant, we feel alive. So I want to definitely help you with that. Talk to you later.